Hello, I am Dr. Aslъ Датлъ, a plastic reconstructive and aesthetic surgeon. Today I am in Sofia and I would like to explain you some of our surgeries that we do for our patients. The mostly asked one is Mommy Makeover. After giving birth and giving breastfeeding, moms are suffering from some saggy skin, some fat deposits around the body because of the weight that they gain during their pregnancy, and they come to us for most of the time for their breasts, for their tummy area, for their legs also, and sometimes for the arms. So we want our patients to stop breastfeeding, and at least 6 months after that we want to do the surgeries. And also we want our patients to go back there, at least get close to their normal weights, and then plan those surgeries. The mostly asked one is breast lifting, and depending on the patient's expectations and depending on the patient's needs, we do breast reduction, breast lifting with implant, and breast augmentation. So those surgeries, that they all have different types of recovery period, recovery time, and also incision size. If you talk about breast augmentation, we mostly use the inframammalian fold incision, which is around 4 to 5 centimeters, depending on the implant that we use. And we put an implant mostly under the muscle, so we use the plane, dual plane, that the upper part of the implant is covered by the muscle, and lower part of the implant is covered by your breast tissue. This is called dual plane. By using this plane, actually we are reducing the risks of the surgeries, such as capsular contracture, animation deformities, or some kind of other complications. Depending on the patient's, again, needs and expectations, we might use a round implant or an anatomic implant. So most of the time we want to use an anatomic implant when the patient doesn't have any breast tissue, and we want to use a round implant when the patient has a breast tissue. And this is also, we decide with the patient's expectations, and we decide together just before the surgery. What else we also examine before the surgery is if the patient has enough breast mass that covers the implant. So sometimes we add fat grafting around the implant so that you don't feel the implant outside the skin, or when you move your body, or when you use your arms. So sometimes we add fat grafting to those implant surgeries. The other surgery that we do is the breast lifting. So when the nipple areolar complex goes down below the inframammalian fold, we need to lift that breast first. Sometimes if the patient has enough breast tissue, then that's enough to do only lifting surgery. But if the patient also wants some augmentation, if the patient wants a bigger breast, then we need to combine those surgeries with a prosthesis. When we do lifting and reduction surgeries, the incision is getting a little bit longer. So you have to think about an incision around the areola, and which goes vertically down to the inframammalian fold and on the inframammalian fold. So you will see 3 incisions after those surgeries. But by time, at the end of 1 year, most of the cases heal very well if the patient doesn't have a too dark skin or some kind of healing problems like keloid or hypertrophic scarring. Most of the time those incisions are hidden by a bikini or your clothes. So we are trying to hide those incisions as much as possible. If you talk about the belly area, the tummy area, most of the time patients have also some fat deposits around the waist. So most of the time we combine those surgeries with liposuction so that we can achieve an hourglass shape of the body. So if the patient has an scarring or strias after the birth, the only way to get rid of those strias are to do a tummy tuck surgery. So you can imagine this incision longer than a sexio incision, which goes all the way to the bones. And with that, we can get rid of the bad quality skin below the belly button, and we can cut the skin out and then make a new and very flat and a nice contoured belly by this surgery. Depending on, again, patients' deformities, we might do a mini tummy tuck or a tummy tuck or just liposuction. So those surgeries are all we decide together, and all we decide depending on your expectations.